My people, if you go hospital for Italy or anywhere, or you go meet your doctor, like for Italy, we get personal doctor where be say if you go meet in case you want get anything. Where everybody gets rights to. If you get resident, you get rights to get doctor. Your picking too, you get rights to get doctor. But one to be say we need to understand for you not going to feel say they want to invade your privacy or can they get argument with the what they ask you this kind of question. Know this the reason why doctors they always ask this kind of questions and why then they ask why they put them for system to know more about you. So if you go meet your doctor, maybe the first time, or you go hospital, or maybe you get belle, you go for visits, especially when na your first pregnancy, even if na your second or third self, they ask this question because it is possible say no be the doctor be say you want meet today, now you go meet tomorrow. If you meet one gynecologist today, tomorrow if you meet the other person, so if it different. See, make we dey guided because most times they they ask this question. See, if you go meet your doctor, they will ask about your family history. You get mama, you get papa. If you talk, say your mama don't buy, your papa don't buy, they can't ask you how your papa take buy, how your mama take buy, which kind of sickness they can't get. You get siblings, your grandparents, then they don't buy, what take buy them, how they take buy. They ask all this kind of question. Why? Because they want to know your family history. For those who be say they get belle, they ask you about your mama, your mate born you, your ma for born you, na normal, na this one. So they ask all these questions. Some say they want just invade your privacy, they want to know about your family. Now, because of you to know your family history, some families they get genetic sickness where they sick. So family their problem na diabetes. Some family they get problem of cholesterol. Some families na breast cancer. Some family depend on the family. So some family history where be say na genetics. So we be say their pikin fit get that kind of sickness. Okay. So if doctor they ask you this kind of question and they want to know your family history, the kind of sickness where be say they the bloodline where they the family. So they will know what they will tell you and the kind of advice wey be say they will give you. Some families the kind of diabetes wey they get now wetin if they always dey kpai them. You just tell me now this thing they kpai them. If you tell you say your papa don't kpai, they'll ask you what kpai your papa or what kpai your mama. So families if the mama don't fit get breast cancer, for instance, they'll come talk say, okay, as your the daughter, you need to go there, check your mom, go do mammography, go do sonography. It is very, very important to avoid and based on say it don't dey the family and family issue. Diabetes, I better reduce this kind of food because say it dey your family, or maybe cholesterol, reduce the kind of oil say you will use because say it dey your family. So doctors they ask you these questions, or they don't ask me, but they ask me again. Nobody say they want just invade, they want just know about your privacy, but now waiting they're very, very important so that they will know your family history, the kind of sickness will be say una they get, and if you get any health issue, or to avoid and make you not get that health issue or that problem you say your family get. Some cases there you will go do tests, you come and say this one not dey okay, this one not dey okay. Of course, if they ask more question, see this one will not dey okay, they your family history. So this one a question be say that they ask generally. Why? Because they want to know the kind of sickness will be say it dey your family your family, which is a very, very important. So any question they ask you, make we try our possible best, give them the right answer. And two, if your papa don't buy, your mama don't buy, make we know you say brief illness, you just buy. Try to know what to buy you there abroad or you there anywhere, your papa buy mama. Try to know what to buy your papa. Try to know what to buy your mama. It is very, very important to know if any sickness there where they on a family. My papa buy when I did very, very young. Very, very young. I just knew finish my secondary school. You knew write my jam. But I still remember what it my am. So each time they ask me question, I go tell them, say, see what happened to my papa. See how it take by. So it did very, very important. Make they tell them the truth. Your papa your mark by yourself. Ask waiting happened to them. It did very, very important to know the kind of sickness where they own a family. Thank you and remain blessed.